Wonderful. Well, thank you everyone so much for joining us today. My name is Nandita Bajaj. I'm the Executive Director of Population Balance. My colleague, Alan Ware, who is with us today, and I also co-host the Overpopulation podcast, which ranks in the top 2% of podcasts globally, where we interview guests about a broad variety of topics to explore the impacts of our expanding human footprint on human rights, animal protection, and environmental sustainability, as well as individual and collective solutions. In addition to the podcast, we also run educational programs such as this one. And by going into schools and conferences and talking to young people with the goal of empowering them to make liberated and responsible reproductive and consumptive choices. We're excited to welcome back, by popular demand, our wonderful guest, Dr. Esgar Guarín, who was a guest on our podcast earlier this year. Dr. Guarín will also give a tour of his famous mobile vasectomy clinic. He's also going to demonstrate the procedure using a 3D model. And finally, he's going to share the surprise announcement in honor of the 10th anniversary of World Vasectomy Day that's coming up in November. That day or that time also happens to coincide with our population reaching the 8 billion mark. And with that, really brief introduction for Dr. Guarín. Dr. Esgar Guarín is a board-certified family and reproductive health specialist. He originally trained in Colombia and is a fellow of the American Academy of Family Physicians in the US and a member of the Medical Advisory Board at World Vasectomy Day. Dr. Guarín was awarded the Family Physician of the Year Award from the American Academy of Family Physicians in Iowa in 2017, and now he works as the medical director of Simple Vase Vasectomy Clinic in Iowa, as well as out of his mobile vasectomy clinic, which you'll get to see today. He is on a mission to help destigmatize male reproductive responsibility for the love of their partners and the planet. And we are thrilled to have you back, Dr. Guarín. Welcome.
Nandita, thank you very much for having me here today. I'm really excited to be back. It's wonderful to have this opportunity to share what we're doing and to talk about the part that men can do, right? The shared responsibility in contraception.
And Dr. Guarín, you are such a great role model for demonstrating that and inspiring that action. And we are excited to delve deeper into that with you today. And why don't we just start right with the reason we are having this webinar. It's in honor of World Vasectomy Day, which is in its 10th year. And since its launch in 2012, your team has performed about 75,000 vasectomies. In fact, it's the largest male-focused family planning movement in the world. Can you tell us a bit about how the day got started and then how you became involved in it?
So it is correct. It is the largest male-focused reproductive movement in the world. We, with the participation of volunteers all over the world, every year we continue to count the number of vasectomies that are provided. But I want to say something that Jonathan Stack, one of the founders of World Vasectomy Day, has always insisted. We don't measure the success of the organization and the number of vasectomies that we've done or we do. We measure the success of the organization and the movement based on the quality of the conversations that we are eliciting. And that's exactly what we want to do. We certainly love the idea of increasing the number of vasectomies, particularly when we look at the counterpart, which is tubal ligations. We would like to increase the number of vasectomies at the expense of reducing the tubal ligations. But what really drives us is the conversations that we can generate by talking about vasectomies, because it's not about the technicality of the procedure only. It's about the implications, the sociological and even anthropological implications of the procedure, because it generates a change in the mind of individuals. Mm-hmm. So that's what we do. Yes, we've done collectively with all the people volunteering all over the place, that many when we count them at the end of the year. But it's the conversations, and I think we have gone a long way with that. So How did it start? Well, it is very interesting because Jonathan Stack, a very accomplished filmmaker from New York City, who's won numerous awards, started his journey of getting his own vasectomy. And as a good filmmaker, he wanted to document that. He wanted to make a film about it. And in that process, he met Douglas Stein, who's a urologist that for the past 38 years has devoted his life to promoting vasectomies. Initially, during his first 16 years of practice, he combine his regular urology practice with the passion for the vasectomies, but that eventually he just left everything else and dedicated only to do vasectomies. Jonathan met Doug Stein because somebody in New York City told him, you should go and meet with this guy down in Tampa. That's all he does. You'll be interested in knowing about him. And Doug had been going around to some places. He'd been going to Haiti. He had been going to the Philippines with Ramon Suarez, who's a urologist, already a retired urologist of Filipino descent. Actually, he's original Filipino. He's not just Filipino descent. He's Filipino himself, but he was a urologist, practicing urologist in the US, doing vasectomies. And they had created a small nonprofit called Non-Scalpel Vasectomy International. And Jonathan was fascinated with this. He thought it was very interesting. And Jonathan's work in the film industry had been mostly doing documentaries. And these documentaries were mainly related to bad things that men do. So he was always in war zones. He was in the prison system doing documentaries about the life of many of these inmates. He has done several pieces of work in the Angola prison, very famously known prison in Louisiana. And one thing that caught his attention when he started following Doug Stein with the vasectomies was that he started asking all these men who were getting vasectomies why they were getting their vasectomies. And he saw a common denominator there, and it was love. It was love. And he was fascinated by that because up until that moment, all he had done was document bad things that men were doing. Right. And he saw that men were capable of a lot of good in such a tiny little procedure. Right. Obviously, he was fascinated about the possibility of making it available to other people and the simplicity of the procedure, the impact from a reproductive standpoint. But what initially made him fall in love with this was the fact that he saw the good in men by doing this. Every time he approached a man who was going to get a vasectomy, he would ask him, well, why are you doing this? Oh, well, I'm doing it because of my wife. She's given us this beautiful children, and I think that is the least I can do. Or I'm doing it for myself because I don't want to have the responsibility of having children. I'm doing it for the environment, right? I just don't want to have any children of my own for this reason because it's too many of us on the planet. I want to do it for my children. I want to be able to use the resources that I have in a better way for my children. I want to do it for my partner because we don't want to have any children. And I think it's unfair for her to go through all the methods of contraception that she goes through already and having to deal with hormones and all that. And certainly the surgery for her will be too much compared to this. And he just saw that. He saw that it was just an expression of love, right? A manifestation that they care for themselves, for the environment, for the children that they had if they had children, for their partners. So he started documenting actually Doug Stein's journey instead of his own journey. He still, did something with his own experience, but then he followed Doug Stein, and there was a documentary called The Vasectomist that was available in Netflix for quite some time. You still can find it online, and it was all about Doug Stein. And so doing all that, they came up with the idea of traveling to Australia to demonstrate the vasectomies. Not that the Australians don't know how to do them. They're really good at that. And the Australian men participate a lot. But they wanted to go and have this demonstration of the vasectomies and combine this idea of these beautiful stories there. So 10 years ago in Adelaide, Australia, they managed to establish a relationship with a local surgeon and with the local authorities, and they did vasectomies in real time on television.
Wow.
And that was the very first World Vasectomy Day. Jonathan thought, well, let's just make it a day.
Mhm.
And then after the success that they had, he said, well, let's just do it another year, but that's it. Let's just do it another year. And then it turned into 10 years. So every year during the month of November, World Vasectomy Day, which is just a group of volunteer people. I mean, the only person that is there all the time is Jonathan Stack and probably 2 or 3 employees. Everybody else is just, I actually work on a volunteer basis with them. We all pitch in and go to a different country. And during 2-3 weeks, a team of filmmakers is assembled and movies about the participation of men in contraception are made. Things like being in Mexico City, showing a big macho appearing wrestler talking about how he would like to participate in contraception and how he is involved in other things at home with his partner, while fellow wrestlers tell him that that's not macho enough, that that's not
Right.
manly enough. And he ends up challenging them and telling them that he's going to get his vasectomy. And then after getting his vasectomy, he's going to beat them up, showing them that he's still as strong as always. Those are the things that we do. So
Right.
videos like that, short movies like that about an imam in Indonesia, talking about how grateful he felt with his wife having the 5 children that they had. And that message convincing people from his mosque, man from his mosque, to get vasectomies is showing that love, that common denominator that Jonathan saw. And then at the end of the month, we get there with a team of doctors and do vasectomies, but do it with a different mindset, not just to snip away, if I'm allowed to use that expression, but to elevate, recognize responsible men who have chosen to be active participants in contraceptive matters, definitely more active participants in reproduction than just helping procreate.
Well, that was such an incredible story. And I'm glad you covered the whole ground there, because it's really helpful to hear just how inspiring the individual stories are of people who chose to get involved, both as volunteer vasectomy doctors, but then also the men who are coming forward to do it as an act of love. And then you also had this background of being a reproductive health physician, a family physician, and then you've kind of done a 180 into becoming a full-time vasectomy provider.
I don't know if it was necessarily that. I think it was more like a more targeted practice. I think having become a full-time permanent vasectomy surgeon has not taken me away from what I was doing. So my initial training was in family medicine. I did it because I absolutely wanted to work with women and children, and there was no alternative. And then during my training, I had a wonderful time taking care of pregnancies, and I loved it. A fantastic time. I wanted to learn how to do vasectomies. I encountered a lot of resistance because unfortunately, many urologists in the area of the country where I was training, which was in the East Coast, were reluctant to provide that training. So I met Doc Stein 10 years ago, about the time all this stuff with World Vasectomy Day was happening, and called him, and he actually trains people. And I went there and spent some time with him, and he just became my mentor on this. Then after some time working alone, I started getting involved with Non-Scalpel Vasectomy International. We traveled to Haiti. And with time, I just grew frustrated with my practice because I kept seeing in the practice of maternal, child, and reproductive health that everything is on the women, be it having a scar on the belly to prove it or just having a natural birth. But it just doesn't make any sense that going through all that, women also have to put up with all the birth control methods.
Right.
So what started in the 1960s as a way for women to take ownership of their fertility and say, I'm going to get pregnant when I want to get pregnant and not when I have to get pregnant, turn into, let's just give you everything and you take care of everything yourself.
Right.
And that is not fair. And that, along with an incredible amount of energy that I felt every time I came back from being overseas, providing the vasectomies, making men happy by showing them that it was a it was nothing. It was not a big deal, but at the end of the day, it was a big deal because it made them participants, active
Yes.
participants in contraception. Made me think that I was not doing things the right way because I identified multiple points of resistance in the process of getting a vasectomy for men. And one of those points of resistance to me was the fact that if you're doing vasectomies kind of on the side,
Mhm.
it's one more thing that I do in the portfolio of procedures that I offer, then I'm not going to be able to dedicate myself plenty to these patients so that I can change their mentality, because that's the problem.
Right.
I feel like we need to change the mindset of men in many places. And I cannot do that on the side. One of my criticisms always was that if that is something that I do on the side, I may end up canceling that patient because of all the things I'm doing, which means
Sure.
I'm not devoting my time to them. Many times I found myself on call for the obstetric floor on a Saturday when I was doing vasectomy clinics. And I was so fortunate. I never had to cancel any of these guys, but I was always just feeling the tiny heartburn every time I was going to go in to see the vasectomy patient, knowing that I was on call, and I would call the OB department and say, I'm going to get into a vasectomy. I'll come back. It's just 15 minutes.
Right.
But it's 15 minutes that if they called me, I'm holding the instruments while I'm doing the vasectomy. So I just didn't think that was right. And with many of my urology colleagues, what can happen also is that if they do a vasectomy clinic once a month on a Friday afternoon, and somebody with a complex disease comes earlier that week and needs the surgery, and there's no other place to put them for surgery but a Friday afternoon, all those patients are going to be canceled because it's an elective procedure, the vasectomy. So they will have to come back in a month later, or a child later. You have to increase the availability for those. So I said, I want to do this all the time. I want to make it as accessible, simple, and smooth as possible for these guys so that I can work on changing their mind. So that's how I ended up. So I think that I went from doing all this maternal, child, and reproductive health, and I just got into a very narrow point, and I'm more laser focused on what I'm doing because I still think I help reduce maternal mortality. I was committed to do that. But by reducing unplanned pregnancies, I help reducing maternal mortality as well.
And to your point about the unplanned pregnancies and the disproportionate degree of burden that biological females have to bear, 50% of pregnancies worldwide are unplanned.
Correct.
And the other thing you mentioned was there are currently 6 times as many tubal ligations as there are vasectomies.
Actually, more. The numbers are more, and this goes to answer the question that somebody was asking, which is what are the trends of vasectomy looking like worldwide over the past decade? Well, it turns out the disparity is more like 1 to 10. So according to the United Nations in 2019, the number of tubal ligations performed were about 219 million tubal ligations, which is the permanent contraceptive procedure for women. 219 million. During the same time, 16 million vasectomies were done.
Wow.
So it's quite disproportionate. We don't have to take it into consideration for that comparison between biological males and females in terms of contraception. The modern methods of contraception, like IUD, injections, because we're comparing permanent methods, permanent method versus permanent method, surgery versus surgery, right? And it's just the gap is too big, it's too wide. And it is too wide when you look at the overall world. But when you focus on certain areas, it's even worse than that.
Sure.
So look at Latin American countries, Bolivia, Ecuador. For every man who gets a vasectomy, there are 30 women getting tubal ligations. What that's telling me is that men are just basically procreating. That's it in terms of the participation and reproduction. They're not doing the rest of it. Is it because they don't want to? Could be. Is it because they don't know enough? I think there's a lot of that, lack of education, misconceptions, wrong ideas that are not clarified. There's no proper education on this. We don't talk about it. In many parts of the world, even in the United States, when it comes to talking about vasectomies, we're left with a ton of emasculating jokes. I think I mentioned this to you before. I mean, I don't think I've ever, and I used to do a lot of tubal ligations when I was taking care of pregnancies as well. I don't think I've ever heard a joke minimizing the value of a biological woman because of a tubal ligation, right? There's no jokes that take away the personhood of an individual because she's getting a tubal ligation. Whereas there's tons of jokes. You just go to YouTube and search for vasectomy videos, and you will have entire comedy routines
Yes.
about the vasectomy and how emasculating they are, you know?
Yes.
So what that does, it just feeds into the whole narrative of this being something that affects you in a bad way, right? So there's a lot of education that needs to be done. So the disproportion is big. The United States is not as bad as those numbers we just talked about. For every man who gets a vasectomy, it is estimated that there are 3 women getting tubal ligations. But my fellow Canadians are doing well, you know, because for every woman who gets a tubal ligation in Canada, there are 2 men getting vasectomies. So the change can happen. And that's not the only place. The UK does that too. New Zealand, Australia, South Koreans, the Dutch. So it's a matter of changing the mentality, and we just need to talk more about it.
And you've been doing an incredible job in helping to educate and destigmatize the procedure and the idea of getting a vasectomy. And one of the things you've done is brought it on the road. So I know you have a video of your mobile vasectomy clinic. Can you show us the video? And then after that, it'd be just great to also see how a real procedure works so that we can continue to destigmatize.
Bear with me. The video is about 3 minutes, and here we go.
You may ask yourself, what is this? And it is what it is. It's a mobile vasectomy clinic. It's basically a clinic on wheels where we can perform vasectomies. It's that simple. In 2017, I was in Mexico City, where we were facilitated some mobile units for the performance of vasectomies. And the idea of performing them in a mobile unit seemed very appealing to me. Not because we couldn't reach far away communities, but because we could talk more about the simplicity of the vasectomies, and we could talk more about the vasectomies themselves. So finally, after 3 years in 2020, we decided to build it. And from the ground up, we developed this, which is a 24 feet long by 8.5 feet wide and 8 feet tall unit that has a bathroom, has a waiting area and a procedure room. It allows us to perform the vasectomies in a comfortable fashion, in a safe manner, and as if we were in any other clinic. But it shows you how simple the vasectomies are, that you can do them anywhere. Let me show you what we have inside so that you can get an idea of how this mobile vasectomy clinic works. So if we're going to do a surgical procedure like a vasectomy, which, by the way, is a very simple procedure, we need to have the conditions, the proper conditions to perform that procedure so that we can convey the safety and the cleanliness of the environment where we are. So this is our clinic. We have a waiting area where the patient actually spends some time with me before we go into the procedure room. We have a restroom completely functional that can be used by the patient. And back here is the procedure room. Let me show you. As you can tell, this looks like any other examination room from any office. It's just on a mobile unit. We have our examination table. We have a sink for us to wash our hands, and we have plenty of storage for us to keep all of our supplies. We perform the procedure here, and the patient leaves the mobile unit through this door. We even have thought about the transit of patients through the clinic to keep it safe during this pandemic time. So we have designed it in a way that conveys safety, cleanliness, and the mobility of the vasectomy. So what is the message that we want to convey when we talk about the mobile vasectomy clinic? That vasectomies are simple, that you can do them anywhere, that you don't need the infrastructure that you need for a surgery like the one that women get, a tubal ligation. We don't need an operating room. We don't need a lot of people working around to be able to do that, a very invasive procedure. A vasectomy happens in the convenience of the medical office. It is quick, it's simple. It takes about 10 to 15 minutes with minimal recovery time. And it is the right thing to do. So next time you see the mobile vasectomy clinic, especially if you're driving behind me, you had a vasectomy. If not, just go and check at simpleVas.net.
That is the clinic.
It makes everything so clear and demystifies all the ideas people have about mobile clinics and how clean and sterile and professional it was. Because I know when we last spoke, there's this idea that, you know, mobile clinics aren't real hospitals or aren't real clinics. Therefore, they must be inferior in some way.
Yeah, one of the reasons why, particularly in the United States, we have such a wasteful and expensive healthcare system is because we are always looking at the ivory tower. So hospitals are extremely important. Hospitals are extremely necessary. Over 90% of the ailments that people suffer from are actually outpatient, don't need to go to the hospital. You know, hospitals are just where the most spectacular things happen. You have a major injury, you require a major surgery, you go to the hospital. You need to have brain surgery, you open heart surgery, you go there. Over 90% of the diseases happen in an outpatient setting. So having a mobile clinic probably for many could seem like a foreign idea. It's not that foreign because when you start looking at mobile clinics, there are multiple mobile clinics in the United States for other reasons, like blood donation, dental clinics. There's no single one except for our clinic doing vasectomies. And this is totally devoted to that. And it was designed for that. They're a great alternative, an inexpensive alternative in the grand scheme of things. It was not cheap necessarily for us, and it brings the services closer to the individual. We do know, for example, in Nepal, the uptake of reproductive services increases when units like this are used. Obviously, in places like Nepal and Indonesia and Mexico, using mobile units, it helps because, you know, it's difficult to have the people with the skills, the specialists go to different areas in the country. So you just take them to those places instead of bringing the patients to where the surgeon is. But here, as I said in the video, the idea was more like using this to give that message of this is so simple that we can do it in this thing that goes around your state. It is so simple. So I thought it was going to be very helpful. It was a terrible business idea, if you ask me, because there is no return of investment here. But it's been our baby at our clinic. You know, my wife bought into the idea finally after toying around with it for 3 years. And it happened because, you know, at the end, she pitched in. I mean, we did it. But it was a terrible business idea. I don't think we're getting anything out in return. We do vasectomies there, don't get me wrong. But the vast majority of the vasectomies that we do them in our offices.
Right. And you also mentioned that a big part of the mobile clinic, of course, was to reach hard to reach places, show how simple the procedure is, but also to bring out this kind of funny and celebratory nature of the procedure to help kind of destigmatize all these ideas people have.
Yes.
Even the sayings and quotes that you have, they are so creative and funny. Can you share a couple of the different versions of quotes that you've had?
Oh gosh, we've had things like recently a snip in the right direction with this discussion of the reproductive rights in the United States. You know, a vasectomy will be a snip in the right direction. I use very often a quote from a patient in Mexico who was a 23-year-old man who had no children, was a graphic designer, was a professional man, young, who came to see us for a vasectomy. And I had a conversation with him. He had gone through the process that the Secretary of Health had established, which was having to talk with a GP, a general physician, and talking with a social worker. They spent a little longer with him because, you know, he was a childless man and he was that young and they didn't want to, you know, regret it in the future, which is fair. But he came to me and I have to have a conversation. I just don't rely on what others do. And having that conversation, it was clear to me that he understood things and understood why, not that I have to judge
Right.
his decision, but I need to make sure that he has put things in perspective. I mean, it would be very irresponsible on my behalf that I just do the procedure without making sure that things have been put in perspective for the individual. So I was more than satisfied. He was a very eloquent man. And I said, well, you know what, let's just do it. But let me just remind you that once more, that a vasectomy is a permanent decision. And what he said to me stuck with me until now, and is that he grabbed my hand and he looked at me in the eye, with this. I told you he was very eloquent and very secure of himself. He said, I understand that, doc, but having children is also a permanent decision. So that's one of the quotes that we've put there. Having children is also a permanent decision. Which one are you ready for? And he was absolutely right. When he said that, I said, oh, absolutely. Drop your pants because I'm going to do your vasectomy right now because you have it clear. He was absolutely correct. I could be a really bad parent. I may not pay child support. I don't spend time with my child. I neglect my child, but it doesn't make the child disappear. It's a permanent decision. And a lot of people question about the decisions of others about permanent contraception. They're not as vehement when it comes to questioning the decision of having them.
Yes.
Which it should be a question that we should ask ourselves, right?
Yeah. Yes.
Sometimes that introspective exercise happens only when we say, well, I don't want to have any children, or I don't want to have any more children, right? Does the individual have that introspective exercise about having them, right?
Yes.
Why?
Yes.
Why, right? Or is the individual succumbing to the pressures of the environment or the people around him or her, saying, in this case, of the biological male individual, right? Well, you have to have children. Well, I don't want to, but then I end up having it, and it's really difficult to quantify after the fact, because whenever you ask somebody who has had children, had you thought more about this, would have you made a different decision? Sometimes for the individual, it's kind of difficult to separate that because they assume that saying, yes, I would have made a different decision means they don't love their children. It's two completely separate things.
Absolutely.
So that was just so telling. So that's another quote. And what else? There's a famous American whiskey company that put out an ad years ago. They say something like, live freely, drink responsibly. Well, how about live freely, ejaculate responsibly? Because it's just responsible ejaculation. That's what it is. Having a vasectomy is ejaculating responsibly. Is making that decision. And we try to come up with things like that really trigger the interest on individuals.
Well, I love all your quotes, but I love the example of the young Mexican man, and then also just your engagement with him, and just how you allowed that conversation to just emerge so naturally, and how you've told me how it's helped even evolve your own perspective around this idea of pronatalism that we at Population Balance work with. You gave such a great example that a common narrative that exists in culture generally, in media and politics, et cetera, but also in medical institutions, is that there is a general bias that everyone should have biological children. And I've heard so many stories and I've read so many papers where women or biological females often have had a hard time getting doctors to allow tubal ligation. And there's this similar mentality that they need to be reminded that they may regret the decision, or they are asked multiple times to consider alternatives so as to keep their options open. And as you said, with this young man and other people who have come to your clinic to have a vasectomy, often have had a lot of time to think about this serious permanent procedure.
Correct.
Especially in a world where having children is the default. It takes quite a lot of self-reflection to come to a decision that is going to be met with some level of backlash and lack of acceptance. So I really love that example. And I love also what you said about, as a doctor, it is your responsibility to share with the patients the permanence of the procedure, the implications of the procedure, to share with them once that the possibility of regret is there, but in as objective of a way as possible, so as not to suggest that there is only one way to
Correct.
follow a
Correct.
life path.
So
So,
one thing, my conversation is usually about putting things in perspective. And what I tell them is all I want you to do is that in 10 years, if for some reason, I'm not saying it's going to happen to you, but if for some reason you change your mind in 10 years, because in 10 years we could be a complete different individual, you can think back about this moment when we're talking
mm,
and you can say, you know what, I went to see this doctor and he put things in perspective for me. He told me about the possibility of regret, and we talk about all that, yet he respected my decision instead of, oh, I went to see that doctor and then he just did the vasectomy to me for me. And I would think that then I would have done my job,
yes.
because respecting the individual doesn't necessarily mean I don't have a conversation with them about the data, the information that I have. It will make me a technician. So I can just do the vasectomies. That's not a problem. Oh, you want a vasectomy? You're 18. Fine, come in. I'll do it.
Mhm.
No questions asked. But they have to display some knowledge or at least give me some feedback about after I provide them with the knowledge and I put things in perspective. If they do, then that's fine. It's like any other medical act.
Yeah, and I just want to add that, first of all, a shout out to my husband, Mike, who got a vasectomy and also had a very similar experience with his own doctor, who was objective, asked the right questions that you're supposed to ask, and showed him, all of the different possibilities. And then at the end of the day, that's what we had decided. And it was simple as that. He went and got a vasectomy in 15 minutes. We've never looked back. And talk about what you were saying earlier, it being an act of love. I've definitely experienced that because, as you said, the invasiveness of a tubal ligation and all of the different hormonal contraceptives that are available for, females, I really was not interested in that.
Sure.
Not to say that they're not fantastic options available for people. I just felt like it took the burden off of my shoulders to have to worry about this. So,
Correct.
I really
Correct.
think the work that you're doing is incredible. And in the interest of time, we
No.
would love to see the model that you have to show the vasectomies.
So
Whether
let me tell you, I'm going to do this really quick and show
yes,
you what we use and model so that you can get an idea. So this one was invented by Dr. Li Shiquan in China in the late 1970s because he wanted to make it easier to do the vasectomies. There was an incentive, right, with the one child policy in
Mhm.
China to try to do the vasectomies. Now they're totally the opposite. They did a 180 now. They want more people. So he developed that. So this is a way to do it. Obviously, a vasectomy can be done in any other way. I mean, the technicalities about this is basically knowing where the anatomy is. You cut the vas deferens. It's a tiny tube that goes from the testicle to the abdomen and to the tubules that end up in the urethra coming out of the penis and bring the sperm basically into the semen.
Mhm.
So you can cut those tubes in any way you want. The question is, how do you approach that? How do you make it the least invasive way so that it's not only just more appealing to the individual who's going to get it, but actually the recovery is better. So, very good friend of mine, Dr. Michel Lebrec, Professor Lebrec from Laval University in Quebec City, developed this model that I'm going to show you here. This is a scrotum. And there are some models in the market that you can buy. They're very, very expensive, like $350. And they don't last that long. They last probably for 3 or 4 vasectomies, and then you have to find a new piece of skin, and that is expensive. So he's been working on with an engineering department at Laval University to develop a model with a material that allows multiple uses so that this can be deployed in a third world country and do training initially remotely before we get to the patients so that we don't injure patients. So with this model, I'm just gonna basically show you, I made a one testicle scrotum for you guys today. So, and what I do is between my thumb and my index finger underneath, I grab the vas deferens. The vas deferens is very superficial. So what I do then is I use that ring forceps, the instrument that has that ring tip, and I grab the vas deferens through the skin like that. Now I know I have it right there. And with a very sharp hemostat, or I just pierce the skin and separate the skin. And I just grab the vas, which in this case is a piece of latex tubing, and get it out like that. And then I grab it. And once I have it there, I'm going to cut just a segment of it, just half for now. We use a cautery to heat the inside. Remember, this portion is going into the belly, and this portion is going down to the testicle. I'll remove this skin to show you the structure and the inside in a moment. But then, assuming this is the cautery, I just put it inside and I heat it. By heating that, the inside of that tube is going to seal. Then after I do that, I just cut it here, right? This segment up here, this is going towards the testicle, and this tiny segment is going into the abdomen. So I'm going to use some tissue to cover it, and then I'm going to send it back in. That piece goes back in. So they are going to be in separate spaces. And by being in separate spaces, that particular technique improves the success of the procedure. If I just cut those two segments and separate them and put a tie with a suture and send it back in, there will be a 14% chance of them getting back together. Therefore, 14% chances of having sperm into the semen again in the future, which is a terrible, terrible, terrible number. This is really close to 0%. We never say 0%, but it's usually well done. It's not higher than 0.5%. So that's how simple it is, the procedure, 4 instruments. So I'm going to remove this real quick and show you. So this is the model, but basically what's inside is the testicle right there. And this is what we had cut. So the vas deferens was together like this. And when we were doing that outside, we just cut it. And we're going to leave it separate like that. They don't get together. And if for some reason they were to get together, this one was already cauterized in the inside, and it gets sealed. 10 minutes.
Wow.
10
And
minutes.
no
10
scalpel,
minutes.
no needle.
No scalpel. Well, the no needle is because we use a device to provide the anesthetic at high pressure. But even if you use a needle, you can use the mini needle technique also. Dr. Lebrecht, we'll have to give him credit for that. So he uses a 30 gauge needle. I don't use needles, but he does, which is super thin, like insulin needle. And the patient doesn't feel that. I've done it before when I go to other countries where they don't allow me to use the pressure device, and patients don't notice that. So it's minimal intervention, highly effective, major reproductive public health impact. I just don't understand why we're not doing it more. So we have to educate more people about it. Not only men who are obviously direct recipients of the procedure, but also women. The way I see it, vasectomies are an empowering tool. It empowers men because it shows them that they can participate more. It empowers women because it lifts the burden off their shoulders, and empowers families because it allows the families to allocate their resources in a better way for the members of the family that already exist, be it because they have children or because they don't want to have any children. You can allocate your resources, financial resources, emotional resources, social resources in a better way. It's an empowering tool. It is.
It makes it very, very easy to see why it's such a simple procedure and why the recovery period is so short. We have a question from a guest. Do most doctors that provide vasectomies test a sample of the semen post-procedure? They said 12 weeks to ensure there are no more sperm. I know you said it's close to 0%, but...
Yes. So many of us have questioned whether or not we need to continue to do that because the technique is so good. But the problem is, if we were to say we don't need to test it, not everyone is doing the technique that way. So you're going to have people doing a different technique. By different technique, I mean the way we cut things inside, because there are multiple variations of that. And in those, and there are some techniques that actually give a higher percentage of failure. So anything that is above 1% is a bad technique. And there's a lot of that being done, especially people who are not doing enough vasectomies per year. They're not skilled on that. So yes, we test it. And the recommendation is between 8 and 16 weeks, actually, by the American Urological Association. I personally just go with the 12 weeks because for 8 weeks, if they haven't had enough ejaculations to eliminate the sperm that is upstream from the point we cut, then chances are you end up repeating the sample 4 weeks later. And if you say 16 weeks later, just to be certain, then the compliance gets compromised, the compliance with the sample. And we already know that 35% of patients never submit the sample. Don't ask me why. I don't know. They probably like to live on the edge and not knowing. But already, if we are talking about 35% or so of patients not returning the sample, if you make it 16 weeks, that's probably going to bring it higher than the percentage.
I'll ask another one that I have. One is we've found, you have, and so have I, that there's a lot of stigma around vasectomies, especially as it relates to it being a permanent method of sterilization. And I think there is similar stigma around tubal ligations. And partly, I believe the stigma exists is because both in your work and in our work in population advocacy, there is a problematic history with the work that was based in ableism, classism, racism, white supremacy, sexism, colonialism. And I know that we're both on the same page that we need to recognize the importance of both acknowledging and denouncing that history where people's reproductive rights were violated, especially those in marginalized communities. And at the same time, recognizing that we cannot allow that history to prevent positive and empowering efforts going forward. Can you share your thoughts on that and, just a brief history as quickly as possible?
So one of the most skilled initial vasectomy surgeons in the United States was Harry Sharp, a penitentiary doctor in Indiana, who just did left and right, vasectomies. I mean, he was really good. He was the go-to person for vasectomies. But the reason why he was so good was because by the 1940s, there were already 32 states in the United States with mandatory sterilization laws for people, for the feeble-minded, quote unquote, for the poor, for people with mental disabilities. And that was wrong. So initially, vasectomies were designed or were part of testing what happened if you cut the vas deferens. The initial studies were done on dogs to see what happened. There was a thought that the testicle would not work the same. Well, it turns out the testicle didn't change. And now we know why, because it's just the vas deferens. Eventually, it became an adjuvant or a procedure that was done at the same time whenever there were procedures done for the prostate to reduce the risk of something called epididymitis, which is kind of an inflammation of a tiny pouch behind the testicle where the vas deferens starts coming out. And then, obviously, it was clear that there was a component of sterilization or that could be used for sterilization, but it all coincided with this eugenics movement and the bad promotion of Malthusian ideas. And then it was enforced. The Nazis were really good at that, and they just did terrible things, not only with vasectomies, but also tubal ligations. But then towards the 50s, after World War II, people started thinking differently about that. And they started talking about the use of this on an elective way. But physicians were very scared of that because they didn't want to be seen as promoting involuntary sterilization. And we got to a point where in the 1960s, the American College of OBGYNs came up with this most ridiculous formula to determine who could get a sterilization procedure, be it a man or a woman. And they said that your age multiplied the number of children you had to be equal or higher than 120 for you to be eligible for that. Where did they come from with that calculation? I have no idea. So that was because they try to protect, the collective mind of physicians. The medical establishment was fearful about that. I think that is not just the paternalistic view that many physicians have, it comes from that fear, right? But also that fear itself didn't allow to maintain a conversation, a healthy conversation about that. So what started as, let's see what happens when you cut it in the 18th century became an instrument of oppression. Now is what I call an instrument of empowerment.
Mhm.
And the problem is we need to talk about that history. Can I
Yes.
answer a couple of the questions that I'm seeing here? I promise I'll go quick. Somebody said, do patients pay into this at all? How many people are required to support the mobile clinic? Me, just me. I drive around. That's it, because that's what we convey when we go to other countries. You don't need 20 people in the OR for the vasectomies. It's just one individual. If you have a skilled surgeon, imagine we talk about numbers, 200 million tubal ligations in 2019. 15, 16 million vasectomies. Imagine how expensive 200 million tubal ligations are compared to 200 million vasectomies if we were to do those instead. 3 actions people can take to help support this brilliant endeavor. You can go to worldvasectomyday.org, wvd.org, and make a donation. It's a nonprofit. You can help with that. Somebody says, how early do you think we should start teaching young men about vasectomies? As early as adolescence. One of the reasons why men are not doing it is because it is pushed back to a corner when we are having those conversations in high school. Talk about birth control pills, condoms, terrific. They have to talk about condoms. It's STDs too, STD prevention. Talk about IUDs, that's great. But we need to talk about vasectomies without those emasculating jokes so that they understand that that's the option. That's an option later on in life.
Mhm.
Now, that same person said that women learn how to take control of their reproductive health at a very young age because of sexual education in school. And I think that's why women aren't afraid to have tubal ligations when they're done having children. I disagree a little bit with that. I think that one of the reasons why women are not afraid to have tubal ligations is because of their investment in the changes that a pregnancy can cause. One of the reasons why men don't do it is because we're not as invested in that. If I were to describe in fine detail, graphic detail, how a tubal ligation is done to a biological woman, then is going to sound barbaric to that person because of all the things that we have to do. But she's going to carry through with that because she knows that the end product means that she's going to be kept from getting pregnant and going through all that stuff. The reason why men many times say, well, you're not going to touch me down there, doc, is because we have no idea what it will be to be pregnant. And you don't have to be pregnant to know what it could be. You just need to know that you have a uterus and that having that uterus can lead you to massive changes in your life, in your body. So one of the reasons why men in general might be a little reluctant is because we don't have the same investment. And I'm not talking about being supportive. Oh, you could be wonderful. Oh, you're so great. I love you for what you're doing. And be there and coach the partner during the delivery and be a terrific father. But it doesn't mean he's as invested as she is. I tell patients often when they come with their partners, she has more than earned the right that you are here today getting this done.
Mhm.
Because if you tell me that beginning at age 11 or 12, I have to expect cramps in my lower abdomen and have bleeding once a month for about 5 or 7 days, I think that in terms of reproduction, when a time comes for a permanent decision, I've earned the right to tell my counterpart to just take matters in his hands. Not to mention pregnancy, not to mention birth control, not to mention the side effects of birth control. So I think that's also a reason for that. And finally, it says there, many female practitioners doing the procedure. Yes, there are female practitioners doing it. Male patients are generally reluctant to have it done by a female. I don't think so. I think it's the same thing. For years, I took care of pregnancies. And yes, there are certain women who feel more inclined to go to somebody from her same gender for her care and obstetrics. But I had wonderful relationships with my patients, with their partners. So I think it depends more on how you approach the issue, how you approach the patient, and how you approach what they wanted to do.
Mhm.
That's what makes the difference.
And Esgar, 2 quick questions because we are at time. One is you have a special announcement that you'd like to share with our guest today. And second, we've skirted around misconceptions about vasectomies that men have. And I think that's a really important question to kind of dismantle all of the ideas people have about what happens when you get a vasectomy in terms of performance, manhood, and all of the masculine pronatalist myths that are out there. So if you can answer both of those questions before we end the session today.
First, the announcement.
Yes.
So since Dobbs' decision by the Supreme Court with the overturn of Roe v. Wade on June 24th of this year, we saw an increase in the number of vasectomies and the interest on vasectomies. And normally for November, I travel to the designated country that World Vasectomy Day is working on and help and do vasectomies there. Because of that increased interest, I did not think it was wise for me to leave the US and instead work in the place where I am and take advantage of this moment of debate in reproductive rights to actually raise the issue of vasectomies. Not because by any means this would help improve the situation with the restriction of the rights of women to choose, not because these two are separate issues. It's great that people say, well, vasectomies are on the rise and the men should get more vasectomies now that we're having a restriction on abortion. That's fine, but you have to be very careful because one might think that, and I've heard it, oh, if you hate abortions, then just get a vasectomy. No, one might think that if you go that route, it is like saying it is okay to restrict the rights of an individual as long as the counterpart is doing something else. And it's not okay, because men should be participating more. But it doesn't mean that because we participate more, then it is okay to restrict the rights of an individual to choose.
Mhm.
Those are separate things. So because it's such an important moment in the discussion of reproductive rights in America, I didn't think it was a good idea to leave. So we partnered up with Planned Parenthood in Missouri. Our clinic, Simple Vas Vasectomy Clinic, will do a tour of vasectomies. So we are going to do collectively 100 vasectomies free of charge, which is worth about $70,000 of surgical procedures in Missouri and in Iowa. So together with Planned Parenthood, we're going to do 60 in 3 different locations of Planned Parenthood in using our mobile vasectomy clinic during the first week of November. And on the third week of November, I'm going to be driving around Iowa performing 40 additional vasectomies. So Simple Vas Vasectomy is going to be doing about 70 vasectomies, and Planned Parenthood is going to do 30 vasectomies free of charge for those interested who go through the process and sign the consent and all that, like anybody else. And we're going to be doing them on behalf of World Vasectomy Day for the celebration of the 10th anniversary of World Vasectomy Day. So that's the announcement. We're really excited about doing this. We did some free vasectomies last year when we were driving from Des Moines, Iowa to New York City to Times Square with the mobile vasectomy clinic. When we stopped in St. Louis, we did I think we did 10 or 12. But this year, when I called him, I said, let's just do it bigger. Let's just do more. Let's just get more places. So we're going to be driving in Missouri. I have a license there, so I can go there, and we're going to do it in Iowa. So that's the announcement.
It's a very special announcement, and what an
we're
incredible
excited. We're really
initiative.
excited.
Thank you for offering
really
that, Esgar.
And
And how can people find out and sign up?
Yeah, for Missouri, Planned Parenthood is recruiting the patients. So calling Planned Parenthood St. Louis, in Springfield, and in Joplin. We're going to be doing 20 per location, free of charge, as I said. And we will be putting our locations in Iowa soon. And it's going to be in our website, simplevas.net. It's just the clinic. And we do the recruitment ourselves. It's all online. And regarding myths, misconceptions, usually what happens in the collective mind of men, and setting aside the obvious fear of needles and pain, which anybody can have, even if you're going to have a colonoscopy or if you're going to get a pap smear, there's fear of that. The main thing is sexual performance.
Mm-hmm.
And that's because of those emasculating jokes, because that's what those jokes do. Oh, yeah, you're going to lose your manhood. You're not going to be as potent. And in the collective mind of man, it doesn't matter how much you learn about the vasectomy. It doesn't matter how much you read about it. There is this hidden fear about the performance. And I like to bring it up quite often to my patients when I have them in the office. I spend about 30 minutes with them, even though the procedure takes 10 minutes. But as you can tell, I keep talking and talking with them. And one of the things that I do is I bring that up. I tell them, look, nothing's going to happen, even though they haven't asked me. Sometimes I even ask them, do you think that, is there any chance that after the vasectomy, you can have some issues with your erections? And surprisingly, despite all the information I have given them already beforehand, despite the fact that they're about to get the vasectomies, surprisingly, some patients tell me, oh, sometimes. Like, no, there's no sometimes. It's never,
Right.
never. And then I go on to explain them, there is no way I can give you erectile dysfunction. There's no way I can, by doing this, I can give you erectile dysfunction.
Mhm.
Because obviously, if the patient, 6 months after the procedure drinks a couple too many drinks and is exhausted that day and he does not perform as usual, guess whose fault is going to be according to him?
Exactly.
My
Yes.
fault. It is not that I'm trying to get out of my responsibility. It's that simply there is no way that I can give him erectile dysfunction. And I explained him also the fact that there's no risk of altering their testosterone levels, because the only way for me to do that is by castrating them. And they don't come to get that. They
Hmm.
come for a vasectomy. And that's one of the reasons, actually, why men don't talk about it.
Yeah.
I've always said that women are more open for many reasons. I mean, much as you hate it, you have to deal with the gynecologist and you have to go to your GYN appointment. So you're more in tune with your bodies and know about the methods of contraception. So when you get together, if you are having a terrific experience with your IUD, out of the blue, you're talking about something else. And you're like, oh, I got my IUD. It's been wonderful. I don't have any bleeding. I don't have to worry about anything, with your friends and talk about it. And then off you go and talk about something else. Men don't do that. We don't get together and say, hey, I have my vasectomy. It was a breeze. I can have sex with my partner and not worry about a pregnancy.
Mhm.
No, because that collective fear tells that man that if he puts himself out there, he's going to be judged.
Yes.
He's going to be judged in his sexual performance. That's a primal, very basic fear.
Mm.
So we need to talk about it, right? I see that as one of the main misconceptions.
Yes.
So that's the education that we need to work on.
Yes, that was really helpful. And I think that is one of the so many pronatalist myths that are out there that create all of these associations that do not exist. Because at the foundation of our identity, there is this idea that we all are defined by our reproductive capacity, and that it's not a choice, but it's a destiny for people. And I think there's a lot of the incredible work that you're doing, and then a lot of the work we're doing to dismantle pronatalism, pronatalist myths, misconceptions is so important in actually allowing true reproductive autonomy to emerge.
That's
so people
right.
can make authentic and liberated decisions about their life paths.
I think it goes all the way down to make people understand that their choices, their options, is their choice, is understanding that you should be able to satisfy your fertility. And for many, that fertility satisfaction is 3 children, 2 children. For many others, that satisfaction is at 0. And that is completely okay. And it's an individual decision. Unfortunately, a well-known billionaire who makes electric cars insisted on the fact that the problem with the world is going to be that it's not going to be enough of us. I think that ideas like that miss the point of actually that autonomy. You say something like that, you cause the fear. It's like, no, you make decisions about your fertility based on what you want. If you are making decisions for yourself and not necessarily because others are pressuring you to make those decisions, then you're going to be satisfied truly. And that's the idea with this.
Absolutely. Esgar, this was an absolutely brilliant webinar with you, and we are so grateful for the incredible work that you are doing out in the community and in educating people through webinars like this and through your mobile clinic. Thank you so much. And thank you so much to all our guests for your brilliant questions, for your participation, and also for staying on a little bit extra.
Well, thank you so much for having me here. And thank you to all of those who participated. It's wonderful. Always great talking to you.
Likewise. Bye, everyone.